Okay, so today I'm talking about the investigation of blood pressure. And pulses. Okay. First of all, I'm just going to talk about the investigation of blood pressure. We actually had a question in my 2010 cardio exam of the basic procedure in a GP office or in a GP clinic. And what they wanted in this was the gold standard procedure of doing it properly with the cuff and the sphygmomanometer. So how do we go through this? Well, first of all, what are you going to do with the patient? You need them sitting at rest, and for 5 minutes or more. You need them not to be talking during it all, not talking. Feet flat. Okay, yep. And for you, similar rules for you for the procedure is also, this goes to you as well. No talking for the doctor. Alright, so that's basically it for what the patient has to do. Sit there. You also want their arm fully exposed. Yep. Alright, so that's what you want the patient doing. So what are you going to be doing with your cuff and your sphygmomanometer? Alright, so first of all, you'll be putting the cuff just above the cubital fossa, and you need to make sure you have the correct cuff size. Yep. And once you've done this, first you need to do the palpation method. Is how we would talk. So that's when you inflate, keep inflating the cuff until you can no longer feel a pulse at the radial artery. Other people say, one of our lecturers said, or just inflate to 200. So you do the palpation method, and then you go, say, 20 milligrams of mercury above that, or some people say, or just inflate to 200 for everyone. Now I'll actually do the measurement itself. Okay, so first step one, you inflate, and then once it's fully inflated to 200 or 20 milligrams above your palpation method, you slowly deflate. And I think tally says 2 to 3 milligrams of mercury per second. And when you hear your first repeatable sound, turbulent sound, that's your first sound, is systolic. And then you're going to get a few sounds for quite a while. And then when disappearance of sound, equals diastolic. Okay, so that's the basic procedure. In the proper way you're meant to do it, the gold standard, I guess you could say, is that you always measure both arms. And you also repeat the measurement on one of these arms, maybe 2 to 3 minutes later. and repeat again if necessary. So that's the real basics of it. Other things to remember is you want to be in a quiet, calm area, which in a hospital is quite difficult to do. Alright, so you've got the measurement. Now what do you do? I talked about hypertension before. The proper way to diagnose somebody is you need to actually do things like your Holter monitoring. Okay, that's basically the next step. For bonus points in an exam situation, you might, talking here, mention the that why you do this like this way, and that's to avoid the oscillatory gap. Okay. So now I'm going to